Hi, my name is Ashley Dibble, and I am a student nurse practitioner at Youngstown State University. Today, I am conducting an interview with an advanced practice registered nurse, and now I'm going to let her introduce herself.
Hi, my name is Macrina Garsha. I'm a nurse practitioner. I did family nurse practitioner at Ursuline, and I'm now a cardiac nurse practitioner at the Cleveland Clinic.
Okay, so first I'm just going to start off by asking just to tell me about yourself.
Okay, so I was born and raised in Cleveland. I have always been around the Cleveland Clinic. I did leave to go to college in Chicago, and then I came back. I love Cleveland. I love the food scene. Always loved being here.
Okay, so can you describe your APRN position and specialty?
So I am a cardiac nurse practitioner, and I work with the structural valve team. My title is a valve coordinator. We work to help get consults completed to get people to come to the Cleveland Clinic for a transcatheter aortic valve repair evaluation, as well as then get them set up with their actual procedure dates and times. And we are the nurse practitioners who do all of the educational appointments and talk to them about the transcatheter aortic valve repair.
So what does like a typical day look like for you?
Usually when we come in the morning, we look at our outpatient department and all of the appointments that we have, and we kind of divvy up all of the patients who we will see in our outpatient clinic. And either we'll be seeing them for their educational appointment or we're seeing them for their pre-op appointment. Other than that, we then go through all of our consult lists where we gather a bunch of information about them, like their echoes, their heart catheterizations, CT scans. If they don't have these procedures already done, we end up getting them set up for a 3-day evaluation here at the clinic. So we spend a lot of our time looking in clinic patients' charts, as well as calling the patient, letting them know that we have their consult, that we're working them up, and then we'll also call the patients to let them know like what the evaluation process is like.
Cool.
And then we work closely with the interventionalists who do the TAVR procedures, help get them all set up, and we kind of do their scheduling.
Gotcha. Cool. Do you think APRNs influence today's healthcare system? Why or why not?
I do. I think that APRNs in the past few years have become like a way larger force in the healthcare. And that's because I feel like physicians have kind of gone down. There haven't been a ton of physicians around. So now I feel like most people are actually meeting with nurse practitioners instead of doctors because there's more of us. It's easier to get appointments with us. And most of the time what you hear from the patients is they actually do enjoy meeting with a nurse practitioner over a physician because we take a lot of time to talk with our patients.
It's funny because in one of my textbooks that I read, it kind of says similar things.
Yeah.
The APRNs are taking over some of the primary care roles because there is a shortage in primary care physicians. So it all makes sense.
I mean, I think I only see nurse practitioners.
Okay.
So.
What are some barriers that advanced practice nurses face?
Barriers that we face, I mean, specifically for Ohio nurse practitioners, we can't work independently. We always have to have a collaborating physician, somebody who's there to audit our charts, that kind of stuff. So that gives us a barrier on being able to kind of have our own autonomy. Nationwide, I mean, they're different in every state, but other barriers to that,
Would you say maybe like trusting, like patients trusting a nurse over a doctor? Do you think that's like a barrier?
that definitely can be. I know that a lot of people, when they call us, they want to talk to the doctor. It's like, well, we collaborate with them. We're not making these decisions. We all come in together. So that is definitely something that we see.
Okay, and then what changes would you like to see made for the advanced practice nurses?
Maybe just a little bit more freedom in our ability to practice, give us a little bit more autonomy. It is a little bit more difficult for us to get like prescription privileges, admitting privileges. So kind of going back over all of the laws and going over like even insurance stuff. Because with our patients now too, we are not allowed to bill for our services if they have not seen a physician beforehand.
Oh, interesting.
Yeah.
Wow. Wow. Okay. Those are all the questions I have.
Perfect.
Thank you for your time this evening.
Absolutely.
Good luck with everything.
You too.
Thanks.